Nairobi City is the capital city of Kenya and contributes close to 21.7% of Kenya's GDP. One of the major challenges affecting the county is difficulty in accessing health services, which has led to increased incidences of preventable illnesses and mortality, including teenage pregnancies in the county.
Since the transfer of functions, including health, which was transferred to the NMS, the Nairobi Metropolitan Services, there has been no avenues for public participation.
Tumekuwa tukifanya advocacy on health budget allocations. Na tumepata kuna gaps. Nairobi imekuwa kuna big gap on budget allocation. Na hii gap imeletwa na the transfer of functions from Nairobi County to NMS.
The provision of Section 104 of the County Government Act of 2012 decree that a county government shall plan for the county and no public funds shall be appropriated outside a planning framework developed by the County Executive Committee and approved by the County Assembly.
We know very well that the Constitution of Kenya, through Article 10, envisages that public participation is very key in all aspects. And also the Public Finance Management Act of 2012 stipulates very clearly that the members of the public should be engaged in the budget making process.
While many adolescents choose to get pregnant, many pregnancies occur in the context of human rights violations, such as child marriage, coerced sex or sexual abuse. Broader socioeconomic factors such as poverty, lack of education, and limited economic opportunities among girls may also contribute to adolescent pregnancy rate in the county. Countries like South Sudan, Eritrea, and Djibouti have managed to reduce adolescent pregnancies to single digit, while adolescent pregnancies in Kenya has dropped from 17% to 14%, according to Population Reference Bureau of 1990 to 2020. Botswana reduced from 17% to 7% in the same period. So where are we failing as a county? According to NCPD, latest report reveals that Nairobi County pregnancies among adolescents stood at 19,561 in 2020 and reduced to 13,319 as of January to October. Adolescents aged 10 to 14 years in 2020 recorded 2,598 cases, while January to October 2021, cases of teenage pregnancies reduced to 2,379.
As a coalition, we've been finding it hard to participate in the budget-making processes because these avenues are not there. NMS has not provided any spaces for civil society organizations such as the MNH Coalition to participate in the budget-making processes in a way to ensure that our views and priorities are considered in the budget-making process.
NMS, in a way that kupata ile allocation imewekwa kwa health ni ngumu, because after the transfer of functions na NMS ndio wanapata funding. Despite kwa Nairobi County ndio wanafanya budget kila kitu, but pesa haiko kwa mkono yao. So sisi kama coalition tumekuwa na hiyo challenge.
6.4% of all teenage pregnancies in this period were from Nairobi County, Kakamega, Narok, Meru, Bungoma, and Nakuru counties. These are the latest contributors of teenage pregnancies, 15 to 19 years. A document Straight News TV possesses It reveals that budget performance for the financial year 2021-2022, health was allocated 100.2 million in the financial year 2021-2022 towards frontline healthcare workers, and the sector was able to absorb 100% of the funds. No budget was directly injected to RANMCAH in Nairobi County.
So tunafanya advocacy but unapata inafika mahali na to block because kama hatujui for example sisi tuna advocate for reduction of teen pregnancies na pia tuna advocate for fourth ANC. So kama issues na teen pregnancy hatujui allocation ni ngapi, so unapata kwetu pia ni ngumu kufanya hiyo advocacy.
We can confirm that in the financial year 2020-2021, the health sector was allocated 79.4 million shillings towards compensation of users' fee, achieving 100% absorption. 45.27 million shillings were grant for universal healthcare in devolved government, and 60.49 million shillings came from the World Bank loan for transforming health systems for universal care system, both which had no absorption. Again, no allocation was prioritized to RANMCAH in Nairobi County, which young people and adolescents fall.
Access to some of these budget documents. These budget documents, they are not available because you'll find that sometimes we want to do analysis of the budget, for example, to try and interrogate budget which has been allocated, for example, to reproductive, maternal health. Sometimes we try also to interrogate the budget which has been released and the budget which has been utilized for that particular cause. But you'll find that we are finding it a problem because these documents are not there, and yet Article 35 of the Kenyan Constitution guarantees access to information.
According to the CIPD 2018-2022, it's clear that inequitable distribution of the available human resource, including prioritizing RANMCAH, coupled with shortages of skill mix in health, which has hampered effective service delivery. Pursuing inequalities in access, new and re-emerging health conditions, changing social behavior, which leads to new risk, HIV and non-communicable conditions that has put strain on the health system, and unmotivated staff due to stagnation. Straight News also understands that the sector priorities in the Nairobi Annual Development Plan ADP of 2022-2023 are loosely in tandem to those in the CIPD 2018-2020. In the Annual Development Plan of 2022-2023, it highlights the key sector achievements for Nairobi capital projects and their status that have been realized in ensuring provisions of quality healthcare services that are accessible, equitable, and sustainable. We realize that the completed projects are those that have been supported by various development partners such as UNICEF, PATH, USAID, and those that are yet to be completed are Nairobi City County Government funded under financial year 2022-2023 under preventative and promotive, curative and rehabilitative, and general administration, planning and support. Again, the three programs to be implemented does not address any direct allocation to RANMCAH, yet it seeks 10.4 billion shillings financial year 2022-2023, up from 9.4 billion shillings allocated in 2021-2022, which this includes allocation from the national government.
Due to lack of these vital and essential budget documents is really hampering our advocacy efforts, because many a times as we engage policy makers, be it MCAs, be it the NMS, sometimes we rely or we want to do evidence-based advocacy. So you'll find that lack of budget data or financial data in this aspect is really hampering our efforts to engage the decision makers, perhaps even to ascertain what allocations have been allocated in the healthcare system.
Because NMS, which is iko under national government, imezuia vitu mingi na pia imezuia kazi yetu.
We have established that the construction of Umoja Health Clinic, that is despite an allocation of 10 million shillings, the sector committed funds in excess.
And I have assured the President that by end of January, all those 24 health facilities in the slum areas will be complete and fully equipped and manned by medical personnel.
Straight News has also landed on a secret document revealing the allocation towards reproductive and maternal health services was reduced from 100.685 million shillings allocated in 2021-2022 to 34.277 million shillings the financial year of 2022-2023, which is a 40% reduction. This is a huge reduction, perhaps contributing to high teenage pregnancies in Nairobi County.
On our service delivery na kazi tunafanya, tuna reach out to the relevant stakeholders. But pia wako na challenge. For example, tuna reach out to TWG ya Nairobi County na pia sub county. But pia unapata the same challenges tunapata za hiyo gap ya finance, pia the same wanapata because they are not able kujua allocations ziko aje. They are not able, pia hata wakijaribu kufuatilia pia unapata ni ngumu.
So we are calling upon the Nairobi Metropolitan Services to be availing these budget documents to the public, to enable these civil society organizations to be able to analyze these financial documents so that at the end of the day, our advocacy actions are tailored in a way that they influence change.
According to the latest statistics from National AIDS Control Council on annual trends analysis on teenage pregnancies in Kenya from 2013 to 2020, between 2015 and 2020, there was 106,419 young adolescents from 10 years to 14 years presenting at antenatal clinics, which is just 6%. These were mostly young adolescents in the upper primary education level, 1.6 million, which amounts to 94% of all adolescent pregnancies between 2015 and 2020 were among adolescents aged 15 to 19 years in the country. The report cites that the country needs at least 25.4 billion shillings every year for commodities. In Kenya's history, 2018 recorded the highest number of teenage pregnancies, amounting to 427,135. However, a monthly trend analysis on the teenage pregnancies indicates a 15% increase in the number from March 2020 to March 2021 for both adolescents aged 10 to 14 years and 15 to 19 years. According to MNH Coalition latest findings on Nairobi teenage pregnancies, within the fiscal year, Embakasi South recorded a high of 22% of the total pregnancies in Nairobi County.
This is an agenda which is important in transforming the healthcare system, and it's high time that the government should step up to avail these public documents so that at the end of the day, we can ensure that there is proper oversight and also there is prudent utilization of resources allocated towards healthcare, because healthcare is very important to all Kenyans.
15 to 19 years old recorded 1,516 pregnancies within fiscal year of 2020-2021. Again, the highest score recorded in Nairobi County. Experts decried that proportion of teenage pregnancies has remained constant over the last 4 years. It's time whether to educate children on their sexual health has to be real or continue burying our heads in the sand. It is time RANMCAH to be funded independently as a stand-alone component in the health budget, or be overlooked as teenage pregnancies and HIV new infection cases rise in the country.
All that we are doing as NMS is to ensure that the expansion of health services reaches the common citizen, and the citizen should not suffer to look for help. Health service will be taken to where they are. That is our motto, that is our spirit.
Budget documents are very intrinsic to improving investment in healthcare system. And why are we saying this? For us in the MNH coalition, we are in the forefront to ensure that we rally the government to avail resources towards saving the lives of mothers and babies, and also to provide resources to ensure that we have comprehensive youth-friendly services at the grassroots level, so that we can be able to curb or to reduce teenage pregnancy, which of late has become a menace within our community.
Adolescent pregnancy, whether intended or unintended, increases the risk of maternal mortality and morbidities, including complication of unsafe abortion, prolonged labor, delivery, and even postnatal periods. For Straight News TV, I'm Ode Francis.